Hello and happy Thursday. Welcome to Module 156. I know some students are still working in 155. Do not be discouraged if you still have some work to complete. That's okay. But remember, you are responsible for assignments in 2 modules. So I'll be checking Module 155 and 156 until Monday. Until tomorrow, when everything should be finished up. If you have any issues, please let me know. And I'll reopen assignments. I see a student popping on right now, so we're gonna wait. Hi, Danielle. And here comes Jenny. Hi, Jenny. How are you?
Hello, I'm good. How are you?
Doing very, very well. Listen, I just pushed record and started talking. I'm so glad you guys are coming on. Hi, Melissa.
Hey, I'm just able to unmute it. I didn't know what to do.
That's okay. So let me ask before we jump into our little lecture, how many were able to get their sim chart link to work?
I
went and did all the steps and got the code, but there was nothing in my grade tab that said the Sims chart or whatever. I didn't see anything like that.
Okay, well, we will look at it, Jenny, before we let everybody go. And I'm going to make sure that I am recording so that everybody can see, because some people had no issues with it. Some had lots of issues with it, and there's everything in between. I just don't want anybody getting frustrated by not being able to do it, because a lot of times it's just the simplest little thing. And then it'll work. So I want to introduce Markira. She started with us on Monday. Melinda, turn your camera on. Danielle, do you not have your hair done today? What's up? Y'all turn your cameras on so this sweet new lady can meet y'all.
I don't have my hair done, but it's okay.
I don't care about your hair being done. Now do I? No, I just want to see that face. And there's Markira.
Yeah.
So I'm excited. Danielle, you don't usually join me either. I'm so excited to see you.
I'm off today, so I was able to catch it.
Well, and here comes another new student that started on Monday, Holly. So I know that getting this book to load and then getting into the link is a little bit of a pain. Hi, Holly.
Hi.
But we're going to figure it out step by step. Guys, this is Holly. I'm going to let everybody introduce themselves. Some of these students have been around for a minute. And then you and Markira started on Monday, so you started together. So I'm going to let everybody just introduce themselves. Let's see, who's my most senior? It's going to be Melinda. So Melinda, you go first. Just say hi and just give them some advice tell them about class. You're on mute.
Okay. Hello, I'm Melinda. My kid is watching cartoon in the background. I love Miss Marsha. She's the best teacher I've ever had. She is so understanding and great with understanding everything y'all could possibly go to why y'all need extra time or anything you need. She's always there. I text her all the time. Hey, Miss Marsha. But
can you? Hey, Miss Marsha, can you? Hey, Miss Marsha,
yes,
would it be okay?
Yep. Miss Marsha, what is this? Miss Marsha, like, she's so good, y'all. I love her.
You're awesome too. All right, Jenny, how about you go next? I know you don't like being put on the spot, but I mean, you got to anyway.
Hi, I'm Jenny, and I just say that, like, the reading, because I know you guys have probably just ain't started coding yet, but I know the textbook reading is a lot. It can get confusing, but when you start doing it hands-on, it'll all start to make sense. So just trust the process and give it time.
Wonderful advice. Jenny, the good thing about this is we're starting in easy modules. These next modules are going to be easy and fun. Once we get this link up and running, it's smooth sailing. All right, Miss Danielle, you're next.
Hi, you guys. I'm Danielle. Like Melinda said, Miss Marsha's great. I'm the same way. I text her all the time. Hey, Miss Marsha, can you help me with this? You know, but as far as class, I'm one of the ones that I work a lot. So I really am not able to catch the Zooms. This is like one of the first ones I'm able to catch. But what I can say is, since I work a lot, I have to do time management. And I would say watch the videos. I always watch her videos because that's what helps me get by the most. Is watching the videos and make sure that you're taking notes, you know, from her videos. That's really what's helping me get through a lot of this without being able to jump on the Zooms all the time. And, you know, just make sure you study just a little throughout, you know, your day. But yeah, it's pretty awesome. You know, once you get into it, it's pretty cool, you know, so I'm ready to move forward.
Thank you, Danielle.
You're welcome.
Okay, so Holly, you introduce yourself to everybody now.
Hi, I'm Holly Bice, and I just started, and I'm excited to start the program and finish it and start working.
Well, you won't have any trouble. You're going to do just fine. We don't leave anybody behind, do we, guys? Everybody has the same chance. All right, now, Markira, you tell us about you.
Hello, my name is Markira. I did start on Monday. I think the only thing that is different probably from you guys is I'm kind of already familiar with working with the different EHRs and everything. So I'm basically just getting more education on the coding and everything. So I'm pretty excited to start that journey.
Yeah, Markira is not going to have any trouble with the next few modules until we hit coding again. So, but you know what? It's always a great way to look at things in a different way, right?
Right.
Now, before we get on to our lecture, I want to make sure that you guys understand when we're looking at the sim charting and we're talking about the EHR system and we're getting in there, that when you go to your facility, every facility has a different EHR system. It's going to look a little different everywhere you go. The EHR system that I worked in looked nothing like Sims charting, but the functions are the same. The functions are the same. So as long as you understand what the functions are and what tools you need to use to make an appointment or do all these different things, you're not going to have an issue. I had a student that graduated and went to work at a pediatric clinic here. Her first day on the job, she was taking phone calls and making appointments. The EHR system was not the same at her facility, but because she knew what the processes were and what to look for, they were amazed that she was answering the phone on the first day and making appointments. That's unheard of. So pay attention to what the functions are. And I'm going to say again, please don't get frustrated if you can't get into your link yet. We're going to get it all figured out. All right, so I'm going to go ahead and share my screen, and look, we're going to talk about the information, right? We're going to talk about the information. We're going to get through the slides. We're going to do a critical thinking questions, and then we're going to go into sim charting. We're going to talk a little bit about what it's telling you when you're trying to get in, and then we're going to try to work through some of that together so that other students who are having the same issues can watch the video this evening and figure out what's going on for them, okay? So let's get into our lecture. Y'all know I can't stand that word. Our conversation. Let's have a conversation. How about that? Okay,
Sounds
chapter
good.
1, Introduction to the Electronic Health Record. So let me move my little doohickey up here. Get it out of the way. There we go. What is a health record? It's a collection of an individual's healthcare information. It's used throughout history to document the patient's healthcare, signs and symptoms, diseases, and trends of disease. Okay, so when you switch to a doctor, switch doctors, you're going to switch facilities. When they call to transfer your medical records, That is your health record. Have you ever had your medical record switched to a different facility? Have you ever had to have a copy of your health record? I know that you're like, duh, we know what a health record is, but just know that throughout history, it's used to document the patient health record, signs and symptoms, diseases, and trends of disease. What's in a health record? It contains health information, administrative information, and legal documents. Do you think a health record is a legal document? Yes or no?
Yes.
It absolutely is. It is a legal document. So let's talk about what kind of clinical information is found in the health record. You're going to have a medication list, an allergy list, immunization records, laboratory reports, pathology reports, vital signs, growth charts, surgical reports, hospital records, history and physical assessment findings, progress notes, radiology reports, and imaging test results. That's a lot, huh? But if you stop and think about anything, any sort of procedure, anything that you could have done in the medical office, that's going to be part of your clinical information. It's got to go somewhere, right? So what is some administration information that goes into your medical record? Patient demographics. Demographics are simply your name, your birthday, your phone number, your insurance, your emergency contact, personal information for the patient. That is patient demographics. When I was a biller, one of our cardiology doctors, he would travel the state of Louisiana, and all he would do is EKGs on nursing home patients. So once a month, I would get a whole box, and I would have to put every single patient into his billing system to get paid. Guess how much? 36 cents. Because they had Medicare, and that was all that the allowed amount was for that doctor, for that. But when I tell you he did thousands and thousands and thousands, can you imagine? I never want to see a demographic again as long as I live, because I spent all the time putting in those patient demographics for that doctor to get paid 36 cents for it. And sometimes it was $1.32, depending on which they could have had Vantage, and that was a little bit more. Okay, let's continue on. It's going to have the name of the emergency contact, patient correspondence, referral and consultation letters. It's going to have your insurance information, your HIPAA claim status, your billing and count ledgers, super bills and encounter forms, day sheets, appointment history, diagnostic and procedure codes. So that's all of our administrative information. Does anybody have any questions before we move on? Nope. All right. So let's talk about what legal documents you're going to need. What is in the medical record as a legal document? Records released, release forms, informed consent documents, HIPAA forms, advance directives, living wills, insurance authorization forms, and healthcare power of attorney. Let's talk about the insurance authorization form. You may not realize this, but if you have medical insurance, whenever you put that in your patient chart or your patient information, you actually sign underneath that saying that the doctor's office can release your medical information to the insurance company. Did you realize you were signing that? That they're able to bill the insurance company with that super bill, with that encounter that you had at the doctor's office. But if the patient doesn't sign that and wants to be billed personally, then you wouldn't send it to the insurance company. So that is a legal document. That is saying you are allowed to send this information to my insurance. Does that make sense? Did you guys realize that, there for a long time, I didn't realize before I started doing this, that when I was signing that piece of paper, I was giving them permission to send my information to insurance. I just thought they would automatically do that, right? Nope, can't do it. It's not legal. We're going to be talking a lot about HIPAA, but not today. Who documents in the health record? It can be a documenter, a receptionist, the medical assistant, the physician or other treating professional, medical biller, or the nurse practitioner. Well, let's talk about, what do you think a receptionist would document in a health record? Y'all think about that for a minute and tell me what you think.
Appointment times.
Appointment times, yeah. Something else?
Demographics.
Information.
Yeah. What about cancellation of appointment?
Yeah.
Yeah, they could document that. So a receptionist is not going to be documenting diagnoses, is she? She's not going to be documenting vital signs. I'm bringing this up because I want to talk for just 1 second about scope of practice. So say that you are hired as a receptionist. Are you qualified then to be the medical assistant who's taking blood pressure and doing immunizations and checking the ears and the weight? Do you think that if you're hired as a receptionist that you would be qualified to do those other things?
No.
No.
Okay, this is what we call scope of practice. Now you need to remember that because it's important. You cannot perform outside of your scope of practice. Now, if you're hired as a receptionist and they cross-train you to do those other duties and you're comfortable with it, is that beyond your scope of practice then?
Yes.
No, not if you're trained.
Not.
Not if you're trained. If you're trained, it's not beyond your scope of practice to do what you're trained to do if you're comfortable doing it. Now, you guys have heard of job descriptions, right?
Right.
Yes.
Look at your job description when you're hired and make sure that you know what you're signing up for. If you don't feel comfortable doing blood pressures and things like that, and it's on your scope of practice, you just need to be aware of what your expectations are. Anyway, I know that was a little bit off of what we were talking about, but I wanted to point it out since we were talking about what a receptionist would actually put in the patient record. You need to be sure that you're always within your scope of practice. You do not want to make a mistake with patients' vital signs and patient information on the clinical side of it. Well, you don't want to make a mistake with any of it, but especially on a clinical side of it. All right, so let's continue on. Do you guys have any questions about that? Is that understandable? Okay, so this is a huge question. Who owns the health record? Who owns the physical record?
The patient.
The doctor's office.
The facility owns the
facility.
paper, the physical record, right? Y'all, I'm a visual person, so that's why I'm picking it up and showing you visually. This is a patient's chart. The physician, the facility owns this chart. Who owns the information written in it?
The patient.
The patient owns that. So because the patient owns the information, the facility owns the document it's written on, right? How does the patient then get the information from here into their hands if they need it?
They have to request it.
Copy.
They have to request it, but that's not the last thing. What's another thing that they have to do? Like you can't, like if Holly says, hey, Miss Marcia, I want my health record information. Can you hand it to me? I simply can't hand that to you and move on. I can't make a copy of it and move on. What has to happen first?
You have
A
to
written, you have to, it's like a written, sign something. A release of information.
So does everybody agree with Holly that it's a release of information? Yes, you'd have to find a medical release form to get your information. Okay. That is very important. I know it sounds simple, but it can get a little confusing. The patient owns the information in the record. The facility owns the paper, the chart, whatever it's written on, they own that. The patient has a right to have a copy of that if they sign the release form. If the patient refuses to sign a release form, Jenny, am I allowed to give her that information anyway?
No.
Absolutely not. They can kick a fuss up, they can scream, they can holler, but unless they've signed your release form, you cannot let that record go. If you're in a facility and someone says, oh, don't worry about it, make a copy of it and give it to her anyway, what are you going to say?
No.
I'm not gonna do it.
You're
No.
going to say, sorry, but I know that I'm not supposed to do that. If you want to do that, that's your choice, but I will not break the law. I won't do it without the release form. It's against the law. Can't do it. Okay, so we all understand that, right? I know I made a big deal out of that, but it is a very big deal. You cannot release information. All right, so we're going to talk a little bit about EMR versus EHR, electronic medical record, electronic health record. Very subtle differences, guys, very subtle differences. So let's look at an EHR is a digital record of health information. EMR, a digital version of a patient chart. Now, I'm not going to make an example. We're just going to move on. An EHR allows access to tools that providers can use for decision-making. EMR is mainly used by providers for diagnosis and treatment. An EHR allows patients' medical information to be accessed from different places. An EMR patient record can not easily be sent outside the practice. EHR, simplified sharing of updated real-time information, and an EMR is not designed to be shared outside the individual practice. So the electronic health record can be shared through lots of different facilities. But an electronic medical record is just for a singular facility. Makes sense? Okay. All right. So what are the 8 core functions of an EHR? Health information and data management, results management, order management, decision support, electronic communication and connectivity, patient support, administrative process, reporting, and population health. So what are the basic EHR functions? Fax and messaging, patient reminders, vital signs data, importation of data, automatic flagging for email, print, and progress notes, documentation templates, provider review of incoming data, image attachment, electronic signature insertion, and CPOE, which is your prescription templates. Let's talk about some advantages of an EHR. It's supposed to improve the quality and continuity of care. It's managing patients with chronic conditions, disaster preparedness and response. I really don't understand that one, but it was in the book, so I put it, okay. Increased efficiency, improved documentation, easier accessibility at point of care, better security, reduced expenses, improved job satisfaction for providers and staff. Now, I'm a little older than you guys. I've been around since before the implement of electronic health records. Matter of fact, I was one of the people who helped Rapides Regional Medical Center take all of their paper records and make them electronic. I was in charge of going through every single file to make them electronic. It was a huge job. It was a lot of fun, but I would not ever want to do that again. So definitely having things electronic is, well, to me, it's so much more organized. I would never want to go back to paper-based at all. So what are some disadvantages of the EHR? Lack of interoperability among some products, the initial cost. Okay, so when I first became a coder at Acadiana Billing Solutions, we had an older doctor who refused to go to electronic health records. He only wanted to do paper, and it was becoming, Medicare was making it mandatory. If he didn't do it by a certain date, it was going to cost him $50,000 for every month he refused to go electronic. He retired. He didn't even have a credit card machine in his office. So that's how old school he was. Financial investment, implementation time, employee resistance, regimentation, and security gaps. Now, I really feel like that this is a little bit outdated, because now we don't even hear about paper-based records. It's all electronic. So, but again, information in the chapter. So this is a critical thinking question. Sherry Macon is a patient at the office where you work. She plans to move out of state and insists on taking her original patient medical chart with her. The office manager refuses to release the record to her. Ms. Macon has just faxed a letter threatening to involve her brother-in-law, a personal injury lawyer, whose ad appears on the back cover of the local phone book, if she does not receive her records within 1 week. Okay, don't answer out of turn. Just hold it in. Who legally owns the health record, and how can this patient's situation be resolved amicably? Okay, Danielle, I'm going to ask you this question. Who legally owns the health record?
The facility does.
The facility does. Okay, Holly, how can we amicably resolve the situation?
A copy can be forwarded or sent to her new provider, if with the right release form.
If we have her sign the release form, then we can amicably resolve the situation and send her medical records. Jenny, what happens if she refuses to sign the release form?
She can't get her medical record.
She can call whatever lawyer she wants to, right? Because it doesn't matter. She has to sign the release form. All right. Do you guys have any questions about what we just talked about?
No.
Any comments? Okay, so what we're going to do next is I'm going to go ahead and get into my ebooks, and we're going to talk about Markira and I went through this morning and figured out, for some reason, we're not able to use that SIM chart for the medical office book. I am looking for, the electronic records book. Okay, so before I get into anything, I have several students who have sent me a picture of this book saying that they're clicking on this book and it's asking them for a course ID number. This is not where you need to be. Once this book pops up and says, yes, you have this book, you need to go back to e-learning and look at the link, okay? So let's go back to my Evolve. So this is what we're going to do. We're going to go to our books. Instead of coming here like we originally thought, we're going to actually go into the red and white book, SIM chart for the medical office, and you're going to follow the same exact steps. It says this item contains an access code. Click here. You're clicking here. You're going to continue. You're going to reveal the access code, and you're going to copy it. Okay, we're done with this website right now. Now we have to go back to Genzabar, our e-learning. Now, some of you guys said that you couldn't see your SIM chart link here.
Yeah.
Danielle, was it you?
No,
It was
ma'am.
me.
I got the
Jenny, you
one.
can't see. Okay, let me get it. Jenny, this is your class right here. Oh, nine.
Yeah.
Okay, let me see something.
Well, I tried. I went yesterday and did download the code. Maybe since we wasn't in that module
Oh,
yet,
you
it
weren't
wasn't
in that
showing up. But I
module
glanced
yet.
before I got
Yeah.
on Zoom and I didn't see it either. Yeah, I glanced right before I got on the Zoom and I didn't see it either. Still, like they had a whole bunch of other stuff showing up, like the coursework, all that, but it still wasn't showing up.
It's because it's not turned on for you. It turned it off. I'm sorry. You'll be able to see it now.
Okay.
I knew that's what it had to be. Y'all, when I tell y'all it took my Zoom link out of it's doing some crazy stuff. So if I ever seem flustered, it's not at y'all. It's because this doggone site rearranges my stuff, takes stuff out, changes due dates. It's driving me crazy. It really is. Okay, so Jenny, you should be able to see that. So you're going to go to your SIM chart. Once you get here, it may look a little bit different for y'all. Remember, mine is going to be different. I'm on the instructor side. You're going to launch your SIM chart. For me, it's going to work because I've already got in there. Okay. So once you get to this point, you're going to put your access code in. Okay. Well, dog nabbit. Once you click launch your SIM chart, it's going to come up, put your access code in. So you're going to copy and paste that access code from the SIM chart book. You're going to put it in there and you're going to click. What did we click, Makira, after we put it in there? Do you remember what we clicked after we put the access code in? Redeem. We clicked to redeem. Then after we clicked to redeem, it came up like Marcia Gallagher and all of my information. I scrolled down and hit next. And it came up. It came up that little brown book. It says give a minute to load. So I gave it the minute. We gave it the minute. Then we went back over to Genzabar. We had to turn off the pop-up blocker because it's going to come up here somewhere. It's going to be like a box with a red dot. Once you turn off your pop-up blocker, you should be able to get in. If you're unable to get in, then we need to do a quick Zoom so you can show me what's happening. But once you do that, you should be able to get in just like I'm getting in. And you're going to go Simulation Playground, start a new submission, and it should come right up.
I was able to get in today.
Okay. Jenny, do you want to walk through? You want me to be able to share the screen and walk through with you? And I can do that with anybody here if you need to.
I think I got it.
You think you got it?
As long as it's showing up. Yeah, as long as it's showing up now. Yeah, I think I got it.
Holly, do you think you have it, or do you want to walk through together?
Yeah, mine's up.
Yours is up. Melinda, you're good? I'm so happy and excited. I mean, at least I've got 1, 2, 3, 4, 5 of y'all, right? Any concerns, any questions, anything that you guys need to talk about? Melinda? The 21st is your last day. What am I gonna do? Y'all may think I'm crazy, but I don't cry over everybody, but I'm gonna bawl when Melinda leaves. I feel like you've been with me forever though, sister. Honestly, I feel like you've been with me forever.